Now we're going to move forward to something that is actually very, very interesting to me. Something that when I was a lot younger, I thought I was going to do, which is going to become a surgeon or a doctor.
Oh, really?
But it's just, I realized maybe the life of somebody should not be in my hands and I should, do the talking instead. We're going to be speaking about robotic surgery.
Robotic surgery, yeah. It's actually so fascinating because if you think about it, normally people would associate robotics and robots and whatnot in regards of manufacturing, in regards of technology, in other sorts of ways, but not really that often people would relate robotics to the world of medicine.
Exactly.
So hence why it is very, very interesting. And with the world of 5G right now, everything is all interconnected. You can actually consult your patients. The doctors can actually consult their patients from anywhere else in the world. They can even do remote surgery as well.
Even 10,000 miles away.
Exactly.
And 10,000 kilometers away. And of course, robotic surgery is not, I would say, relatively new-ish in Malaysia. It was actually probably introduced in 2003 and first used in urology.
Yeah.
So that's actually, again, something that we want to delve into in how first robotic surgery was introduced in 2003 and how it has compared 20 years later. What are some of the advancements? And most importantly, what types of surgery can we use it
So
for?
not listening to a bunch of commoners over here, let's listen to the doctor himself. We have here together in the studio, Dr. Ahmad Kushairi Khalid. Okay, I'm definitely going to butcher this. Consultant otorhinolaryngologist from UiTM Private Specialist Center. Did I get that right?
Yeah, you got it right.
I was dreading that word. Assalamualaikum, doctor. Thank you for coming down.
Thank you, Mio.
He was sweating,
I was sweating bullets out my head thinking about that word. But again, what does that word entail? What it is actually that you do before we dive in more into this topic?
Otorhinolaryngology is actually a Latin word. For oto is ear, rhino is the nose, and larynx is the throat.
All right.
And now, actually, in the specialty, we already expanded to the head and neck surgery. So the full term of the specialty is otorhinolaryngology, head and neck surgery.
All right.
Wow.
So yeah,
you must be fun at conferences, right? Introducing yourself, what you do.
It was quite difficult for me in the first time, but
Sure. Now
that's what I do.
Yes, exactly. And that's what you do in the surgery room as well, right?
Yes.
So let's first get into it by asking, of course, can you explain to our audiences, to those of them who've never seen it, who's never watched any medical shows, what exactly is robotic surgery and how exactly does it work?
Right. Robotic surgery is relatively new, I would say, in Malaysia. But the fact that it has been used and it has been utilized in other advanced countries way before us, So like in Asia itself, I would say that Korea and Singapore, they are the most advanced in this technology.
Right.
And now we have to say that we can offer this to our own citizens, which is very good. So robotic surgery entails a surgeon who still operating on the patient, but they do not necessarily have to be at the patient's bedside.
Okay.
So they translate their movement through a console, and then there are three biggest part of the robots. There are the console, where the surgeons operate. There are the CPU, which is the central processing unit, which is the brain of the robots. And at the CPU is the monitor, where this monitor can be projected elsewhere in the world. You can have other surgeons that can give input to you. You can have students watch your surgery and learn from it. And you have the robotic arms, which will be at the patient's bedside. So these are the three main components of the robots. So actually, the surgeon is still doing the surgery, but the movement will be translated to the robotic arm.
Yeah. So essentially, the robot itself, or the machine itself, is an extension of the surgeon, right?
Correct. Correct. But you do not need to be at the patient's bedside. So the history of it was first built for army. So the doctors are afraid to go to the battlefield, but they can still treat the injured army elsewhere. So this was the history behind the robotic surgery. But of course, it has evolved, and now it has been used widely to a lot of surgeries.
So we all know, I mean, again, people use robots specifically in the manufacturing industry because of its precision, because of the fact that you could literally pull out a single hair from a certain surface, for instance. I would also assume, hence why, of its precision, it can be very useful in regards of surgery as well, using machines and robots, Doctor.
Yes. So the main advantage of the robotic surgery includes high definition 4K view in the console, and then the robotic arms is thin, it is durable, and it can rotate 360 degrees. Hence, you can reach difficult areas in the body with precise motion. So this is the main advantage of the surgery, apart from huge scar to the patient, because before this, to assess the area, you might have to make an opening at the neck, for example, or at the throat. But now you can do everything, or most of the surgical part, utilizing the natural orifice, utilizing the oral cavity. So you don't have any scar, you don't have a tracheostomy to help you breathing. So this is the main advantage. But you lose the tactile. So, you know, when you operate on the console, you don't really feel when you're pulling the tissue. So this is the really critical part of the training, to make sure that you have a good, you know, insight of the robotic arms operating, because you lose the touch.
You don't have the sense of whether or not you're tugging too much,
whether you're retracting too much, pulling too much, because you're just doing it on the console.
In that case, speaking of the training itself, how long does it take to train a surgeon, especially surgeons who are, you know, currently doing the housemanship, who are new to robotic surgery? How long does it necessarily take to train to do this robotic surgery?
Right, there are a few steps before you being gazetted as a robotic surgeon. It starts with, there are 4 phases, to be honest. So the first one is the introduction to the robotic parts, and with this introduction, it can, you know, give you more insight about how to select the correct patient and how to conduct a safe surgery utilizing the system. And then you go to the phase 2, where you have a lot of practical, in terms of theory of the robot. You have to complete simulation hours on the console, so that you can pass the test. Simulation means you train yourself how to suture, how to dissect using the program in the console. Apart from that, you have to do some online module where they test you in terms of the artificial intelligence of the robots and how the robots function. And then only you go to the phase 3, where you have a supervisor on site with you, observing surgery before they go to you to see that you conduct the surgery yourself. And then the phase 4 is where you do your surgery yourself and expand your knowledge by sharing with them in terms of international conference and sharing difficult case with them. So these are the phases that you have to go through.
And speaking about all of this kind of surgeries, obviously the fact that you are again, I'm going to do this again, otorhinolaryngologist yourself. What kind of surgeries that you normally perform when it comes to robotic surgery using robots?
Right. So, like I said to you, now the specialty has expanded to head and neck surgery. So basically, we operate from the neck above, apart from the brain, because the brain will be handled by the neurosurgeon.
For sure.
So. Most of the cases involve tumors in the oral cavity, or the oropharynx, which is deeper, or even the larynx, which is the voice box. So we operate on these places for benign or non-cancerous tumors, or cancerous tumors as well. Apart from that, we also operate on patients who have problem with sleeping, like snoring, or like choking during sleep when they are not breathing during sleep, waking up at night, you know, gasping for air and stuff. And other specialty and other areas has been expanded as well, which I, to be honest, still learning. Thyroid, you can tackle, thyroid surgery, you can tackle with robots without any scar in the neck. You can do it utilizing the system, and neck dissections for tumors and cancers of the neck.
So it's easily to say that it's quite limitless, isn't it? The possibility. I mean, I mean, not just in your particular department, but across all fields.
Yes. To be honest, when I first started, there were only about 3 robotic companies. But now recently, I went to Australia, being invited to share my experience there, and there have been like 15 robotic companies, some of them awaiting FDA approvals, and the price is, you know, is getting lesser and lesser. So I think it is the future, and more hospital will be, you know, able to acquire this system in the future. And you know, in Korea, if you still have a scar in the neck, they can sue the doctor if the doctor didn't offer them the robotic options. So that's how advanced they are, because they have like 2 or 3 systems in a hospital. So of course we are moving towards them. Still a long way for us. And I have to say, when I first started, we look up to countries like Singapore and Korea in terms of this robotic surgery. And now countries like Indonesia, Vietnam, I have a surgeon from Bahrain comes to learn from us, because they are also starting their program. So it is the future, and it is now here.
Yeah, and it's starting to be a global movement in a way, right?
Yes,
Where robotic, again, the advantages of performing robotic surgery is limitless. Like you said, it reduces scarring, it reduces downtime as well, and you get a lot more precision for the doctors as well. But I want to come back to the patient, because earlier you mentioned in phase 2 is that is everyone suitable to do robotic surgery, and what type of patients that are suitable to do robotic surgery?
Right, this is a very important question because when you first started, you know that you want to do a safe surgery. So patient selection is very important. You know, although you can deliver a good results with the system, but you also have to know your limitations. Like I mentioned, you lose your touch because you don't know how much you pull the tissue. Number 2, you have to know the limit. For example, a tumor. If the tumor is too big, or if tumor have encased a big major vessels like an artery or important vessels of the neck, or if you know that you cannot clear the tumor because the tumor has extend to the sideways, because usually you start with the oral cavity is in the middle, and then you have to go sideways. But if it has extend two lateral or two sideways, you cannot clear everything with the robot. So these kind of cases, you may think of doing it in the conventional method. So there are some limitations, and you have to know how to select the patients.
So it's not as simple as me going into a hospital one day and saying that I opt to choose for a robotic surgery. It's not as simple as that. That's criteria that needs to be adhered to and being followed to.
Correct, but I have a lot of patients who requested like that. Once they know about this technology, doctor, you operate everything with robots, right? Of course, I said no. Can I request to be done?
All right. Why would they choose that? I mean, like, they're just on top of my head, because I mean, me personally, I think I would want to have that human touch. At least I have someone to blame at the end of the day. No, I'm kidding. I'm kidding. But
hey, you can't, it's necessary, because whenever let's just clarify that before you sign a surgery, you do need to sign a clearance form saying that you understand the risk and all that. There are procedures before. We just like to save doctor before.
No. He's fine.
Actually, it's still the surgeons who control the surgery. Number 1, because you are still the one who do each movement. So the arms just translating your movement. Number 2, there are always plan A, plan B. If it doesn't work, you can still convert to conventional during the surgery. So these are the steps to make sure that you conduct a safe surgery. It is still the human who controls, but of course, with the advantages and the technology, you can expand the indications more widely, you know.
I'm actually curious, in your vast experience of doing robotic surgery, do you remember a time where it was difficult for you to, proceed with it, but then like me, which is the type of patient, I want to do the robotics, I insist on it. So how do you handle that type of case, and how do you handle that type of situation?
Actually, to be honest, I was quite surprised, because some of these patients really requested for it. Means that they really look up into advancement in technology. But when you explain to them about the indications of doing it, and to make sure that she is safe after the surgery, mostly they will understand about when to do and when not to do using this method. But to be honest, to answer your question, when we first started the robotic surgery in head and neck region, that was in 2018. It was a stiff learning curve. Even not me myself, but my support staff, my staff nurse, takes a lot of time to drape, to prepare, to drive the robot to the patient, which usually, it takes about 10 minutes, but we took about 40 minutes, 50 minutes. So that's how stiff it was that time. It was difficult, but of course, by more cases and time goes on, now we can, operate it, proceed easily like any other places in the world,
I'm curious in terms of the advancements of robotic surgery itself, or the machine itself. As one of it, I know it's the Da Vinci machine, right? Where it has like 4 different arms, and you can do a lot with it. So from 2003, when robotic surgery was introduced in Malaysia, to 2023, 20 years of technological advancement. Like Neo said, that we're introducing 5G as well. You can do remote surgery. Where are we going to be in the next 20 years, or where are you hoping our field of robotic surgery here in Malaysia specifically is going to be in the next 20 years?
Right, that is a very good question. To be honest, we have expand and we have advanced in terms of promoting and also offering this technology to the patients. Starting this year, actually for the past 2 years, the installation of the robot has increased in Malaysia. 2003, that time we only have, I think, one system back in Hospital Kuala Lumpur, and it was only offered for urology, means pelvic work. But now the indication has expanded. The numbers of the robotic availability in terms of hospital has also increased in Malaysia, and a lot of other specialty can operate utilizing this system as well, like orthopedic, like cardiothoracic, abdomen for general surgeons, and of course my specialty, head and neck surgery. So it has expanded in terms of the utilization of the robots, and this year itself we have installed about 5 system of Da Vinci in Malaysia. So to be honest, we are not that far behind. But the saturation of the machine is only mainly in Klang Valley. One of the system has been installed in Sarawak, Hospital Umum Sarawak, so that's a good thing that we can offer that to Sarawakian. But of course, my view is we should expand and we should, promote this and offer this to other citizens throughout the country, not just in Klang Valley.
So ultimately, Doc, is it safe to say then robotic surgery is for everyone, should they can afford it?
Yes, of course. If you dive deep into this, you know that this technology gives you, like you said, a very low downtime. And when you have to go some major surgeries, you have to stay in ICU for 1 week, for example. You have to have a tube to help you breathe. It is not pleasant. Of course, you can save a little bit by doing that, but you wouldn't want to, because there is another method that can avoid you from having all that, apart from discharging you from hospital after 3-4 days. So this is like I
quick
said,
over turnaround.
Yes, because you convert a major surgery into a minor or moderate kind of complexity of the surgery, without the scar, without the other associated effects of the surgery, like breathing pipe. It's hard for you to talk. You cough a lot with a lot of saliva. Your quality of life will reduce.
Complicate other, other complications.
In terms of larynx, for example, voice box, with correct selection of patient, you can save the patient voice by removing a cancer. Before this, it's always like you just have to take it out, and the patient has no voice. They have to use the robotic, sometimes the robotic voice prosthesis. But now you can do that. You can preserve the functionality of the organs.
Of modern medicine.
Exactly. So those are all the advantages that we have spoken about. And of course, you spoke a little bit about the disadvantage, which is you're not able to feel the patient, right? What are some of the other disadvantages of robotic surgery, other than not being able to have that human touch, per se?
Okay. Well, I wouldn't say that the tactile or losing the touch is disadvantages, but with a lot of training, of course, you can handle the tissue well. But without touching the tissues, it gives you one more less of a sense. Number 2 is the limitations, like I already explained to you. Not all surgery are suitable for robotic usage. So, of course,
what are these surgeries that are not suitable for robotic usage?
Like I said, if the cancer has advanced, or if the cancer has spread to major vessels, for example, the big vessel in the neck, it's hard for you to control the bleeding with robotics. But again, this kind of indication has widened as time goes on. They produce more, suitable machine to handle that. So in the future, of course,
with
this limitation,
the advancements of technology, it will
this
become
limitation will,
Who knows? Robotic surgery can help Neo grow his hair as well.
Let's not go there. So let's not go there. I'm happy with the way I am. But I mean, we are almost running out of time here. But I do want to ask your opinion on this, because again, you've been very much side by side in regards of the technology, in regards of robotic surgeries moving forward. And you've also answered Zoe's questions. What's going to be happening in the next 20 years? But you personally, within the short period of time, how much benefit can it actually give out to Malaysians out there who actually opt for this quickly, rather than having that mentality of wait and see and let others try first?
Right. The main important factors for you to have the eligibility for this system is if you present early to the doctor. This is number 1. Usually, if a tumor or a cancer is in early stage, of course, you can excise very well with this system, you know, avoiding you from having other extensive scars. So for patients, for citizens, if you have any problems, please come early. So when you come early, you have a lot of methods of treatments. Don't watch until the tumor grows, or if it has spread elsewhere, it's very limited options that you have. Apart from that, in terms of patient-wise, they have to go to the right center. Usually I have patients who have go to other doctors, but because they didn't have the tools to address that area, they've been treating it with medicines. If you go to other centers or the right correct centers, you can, you know, tackle the problem with this system. Yeah.
All right.
Yeah, that is beautiful. Again, thank you so much, Doc, for coming on and sharing with us, you know, your experience.
Now you say his designation before we end.
It's your turn.
Hey, I can say consultant otorhinolaryngologist.
Yes.
I've practiced many times.
He watches Grey's Anatomy a lot, hence why you're like...
I actually do. I watch a lot of Grey's Anatomy. I watch a lot of doctor-based shows, medical-based shows. Of course, I watch it on YouTube as well when debunk all of this. So to me, like I said, I have always wanted to become a doctor, but unfortunately, I'm just not skilled at it. I'm not skilled here. But again, thank you so much, Doc, for coming on the show, for sharing your experience.
Thank you for having me. Yes.
Who knows? 20 years down the road, I'll be seeing you at surgery. Hopefully not.
Hopefully for lunch.
Hopefully for lunch,
not for anything else. All right.